the health system in general is very large and very hard to change direction. And we'll have to kind of be a bit more nimble in order to kind of take advantage of these things, because otherwise people will either go do healthcare somewhere else, and we don't want them doing that. And we really want to stimulate the economy here. So there are barriers in a good way of health data between the health system and, say, universities. We want to make sure that things are anonymized, that it's secure. But I think I think the government's working on ways so that is still secure, still confidential, but allows that health data to be used in a good way for the development of technologies and benefits for Albertans. I don't know if
what I would want to add on this is, I agree with much of what's been said. One real limitation, I guess, so to back up a bit, the government of Alberta has made major investments on improving the quality of the data that the healthcare system tracks. When I look back on where we were in 2004, I was living and working in Red Deer. It was very challenging for me in the child health space to get information from the Calgary Health Region at the time, the Capital Health Region at the time, because half our kids went north and south for tertiary care at the Stollery and at the Alberta Children's Hospital. That is no longer an issue. We can get the data quite quickly anywhere across the province if you're unfortunate enough, I guess, to have to receive specialty care. At the end of the day, though, both primary care and acute care, and I would say the other agencies, are all dealing with people who are sick and have data that's around illness. What we don't have, and where the personalized medicine, I think, can come in with Fitbits and other things, is we can start to track data before you're ill and have access to look at really health versus illness, right? And so, and I think that's where when I think about the digital twin opportunities, if we rely just on a healthcare system data, you're really limiting yourself to people who have become sick, and you don't have the track record of their data prior to them become ill. The Alberta Tomorrow Project is a major initiative funded by a number of different parties, but the Alberta government has been a core funder of it. But it has tracked and received consent of 50,000 Albertans to receive their data as healthy Albertans, and then as they age and enter into the healthcare system, whether it's through chronic disease and primary care, or if they need specialty care in the acute care system, they can then go back retrospectively and look at were there any indicators, and that can start to give you the signals you need when people are still reasonably well, but are at risk of becoming diabetic, for instance. So I think the personalized medicine opportunity is certainly a growing opportunity. The private sector, through Fitbits, through other technologies, will become or create platforms that can help complement the data that the healthcare system will track. And those investments on the healthcare side are important, but they're only part of the picture. They don't give us the full picture that we need in order to understand how to predict where someone's risk factors, whether it's social determinants of health or genetic information. So there's that whole omics component, which is a whole other part of precision medicine, where that might be able to help inform what treatment options might inform someone's care and improve their outcomes.
So, one of the big challenges here, and one of the things that CAMS is trying to sort of bridge, is that commercialization gap. We've got a wide panel here. Perhaps I can ask the innovators, the funders, and the healthcare folks on the panel here, how one can best navigate the system with an eye to bringing technology to market in the most efficient way possible.
Start out with a gap, a need first. Make sure that what you're building, what you're creating, that there's an actual need for it. So talk to people, do the research, do the market research, and only after that, start building and investing in it. Once you do, there is a big gap between that commercialization, because we live in a society of validation, and especially in the medical field, we do want that validation. We want to make sure that things are doing what they're supposed to do and that they do work and that we're not misfiring here. So with that validation, that is one of the biggest blocks that I have found as an entrepreneur to getting products to market, because there's so much regulation, there's so much proof that you have to do up front. These things are costly, they're they're time consuming. And so be aware, it's a process and it's a long process. And those barriers have to be kind of taken on one by one.
So I think there's a lot of very important elements, even locally within Edmonton. There's CAMS, there's opportunities for preclinical validation. We've previously worked with the Glenrose Rehabilitation Hospital. But I think there is a very big opportunity to more holistically evaluate how innovators are on-ramped into that pipeline and to look at their user journey throughout that. So we have a lot of capable facilities, but I think there's an opportunity for communicating and connecting trainees to actually utilize those in a bigger volume. I would like to see CAMS massively oversubscribed, because then we're going to get better quality projects. We're going to be training innovators by getting them to innovate, and we can close the circle, but only if people are willing to take a step back and reevaluate what their mandate is. If everyone's mandate is siloed within their institution, within their individual departments, sometimes within the same institution, their different departments are working against each other. I think if there's a willingness to take a step back and bring to the forefront everyone's intention here is to make a more effective, a more vibrant health innovation ecosystem. And if there's a willingness to kind of realign those pathways, reach out a hand to a much bigger volume of trainees. I've been on the ground. I am a grad student talking to hundreds of very passionate and capable minds, and they want to work on these things. But there's just not a recognition that there's a lot of disincentives when they could very easily be incentivized to engage in this. And that will make the entire innovation pipeline much more vibrant.
Go ahead, Sunil.
I just want to pick up on something you said, Eden, which is around ecosystems. So I think that in order for you to effectively navigate, so all you mentioned, so number one, you need to have a problem that people care about. Like that's start there. And then the ecosystem, I think you're all part of it. Everyone here in the audience here and everyone at this conference is all part of our ecosystem. And I think that the ecosystem that we have here in Alberta, it's robust. It's not perfect, but it's robust. We have post-secondaries here. We have Neuro Alberta Tech representing student groups. We got a number of industry partners here in the province. We got our health system as well as provincial and federal funding agencies representing here. So they often will be willing to talk. There's no charge. They're willing to talk, share ideas to try to help you move forward. So I encourage everyone, if you're trying to navigate, just talk to whoever you find that to share experiences to try to navigate. I think that's a starting point.
What I would add is commercialization is critical. I see it as essential for scaling. So if you saw the Glenrose table, for those of you that went by there, there's for rehab therapists creates a brand new technology to solve a problem at the Glenrose. That's fantastic for the patients at the Glenrose. It doesn't help our rehab patients elsewhere at our other hospitals or in the community. So we need ways for ideas, whether they're coming out of the university, coming out of the entrepreneurial sector, or coming out of our own clinical practice, to come to market so that we can procure it and make sure that it can be purchased and deployed so that Albertans across the province can benefit. And Acute Care Alberta has a mandate to ensure that innovations of value in one part of the country or one part of the world is brought to bear to improve care outcomes for all Albertans. I marvel at what any entrepreneur signs up for. It's a huge task. The health system is not your friend we are not competent in helping you design a business. Our role really is around giving you feedback on the problem, trying to articulate them at a level of specificity that can be solved, and then to give you feedback on the nature of the prototype that you might have come up with, what the impact on the care models might be. The ecosystem is essential for us, both in signaling what is appropriate to come to us, as well as de-risking the business side. So there are clinical risks that we are experts in trying to understand, but the business itself is also a risk factor. Are you going to be viable in 2 months or a year? Do you have the regulatory approvals? Do you have will your solution work in our environments, and which ones? Because not all hospitals are organized the exact same way. So we have to look at a number of different non-clinical issues, and we rely on our ecosystem partners to help entrepreneurs, whether they're at the startup phase or a more mature company, to be able to tackle those issues. So the ecosystem is essential to all of this, and very appreciative to have entities like NAIT, CAMS, and others to help us sort out where does an innovation belong and who will benefit from it.
Perfect. It looks like we are right at the end of our panel discussion here, but I just wanted to close with perhaps a call to action. If we were to put together a working group to put into action some of the great advice that has been just described here, who should be at the table? Very quickly, please.
The list is
Look to the
long.
Health system. Mark, you want to start this one off? You're the
Well,
market.
so we talk already, so I don't know if we need another working group, but there's definitely opportunities to think about what are the constellation of needs. So Acute Care Alberta is beginning to articulate 6 priorities from the Minister of Health. Primary Care Alberta has a number of priorities that they're working on. That can start the conversation on where the opportunities are from a system perspective, but there's going to be organic opportunities, people who are frustrated with a particular situation, and working with entrepreneurs like Ollie and others to come up with solutions. And then I think, for sure the health system wants to be at the table to look at what does readiness look like, where does the health system, what are the needs that it will be looking at, or what are the issues that it's going to be looking at when there's a new opportunity. But we need our partners, our post-secondary you have a good representation around the table today.
And I would also say, sorry, I would also say, have the industry there from the beginning. Don't look for that off the shelf product and then be frustrated that it's not what you want it to necessarily be, what you want it to do. Involve them early, involve them in the process of the building. There's a lot that can be iterated through that, and you get a better quality product in the end.
And that's really what AMedico is trying to do. We're trying to bring together industry and academia and students and the healthcare system to solve the right problem. I loved when you said that. Don't just make a widget and go around and shop. Where can it go? Solve the right problem, co-develop the solution, and then make sure it's going to fit in the health system, make sure that it can be manufactured, make sure there's a market for it. So we're trying to bring that group together. And I think the Alberta government investing in us was amazing. That and Health Everywhere, the other major innovation fund, really are showing that this province wants to do exactly what you talked about, which is bring everybody together and do this. And so, yeah, come talk to any of us about getting involved.
Great. Thank you very much, everybody.
Thank you.
Thank you.
Your notes.
Excellent job, everyone. Thank you so much. We have a wonderful selection for you over the next 30 minutes. In 30 minutes, we would like you to come back as the dean will be taking the stage for some final remarks. But just so you know, the next 30 minutes, there is a research presentation happening right here on the stage presented by MedTech Canada. Dr. Michael Callis, who is just part of this wonderful panel, will be providing an overview of A-Medico research, training, commercialization, and community. Or you can head to a breakout session, once again, in the corner in that direction, presented by MedTech Canada. Emilio Violato will be there for Simulation for Innovation, the importance of environment and end users. Of course, if you haven't checked out the booths, now is your opportunity. If you haven't been on a tour of CAMS, now is your opportunity. There's also a pitch competition happening in the Dow. Please come back. We will see you in 30 minutes to hear from the dean. See you then. Okay, everyone, round of applause for Mike Callis. Let's bring him back onto the stage.
Okay, for those of you who left, come back. So I think this is a little high here. I'm gonna just move it down. There we go. Can you hear me? Okay, waiting for a slide. Oh, how do I advance the slides? Is there a, oh, here it is. Okay, got it. And yay, slides are there. Awesome. Okay, so yeah, my name is Mike Callis. I'm from the University of Calgary, but I'm here to talk about A-Medico, which is a provincial initiative called the Alberta Medical Device Innovation Consortium. So what is that? Really, we're bringing together academia, industry, and community to build programs around training, around partnerships with industry and commercialization, and translation of medical device technologies. We're funded by $7 million from the provincial government with matching money from the various post-secondary institutions. So really, we're a network of researchers, we're community members, we're industry, and really want to reinvigorate the medical device industry in Alberta. There's a lot of things happening in pockets, and we wanted to make sure that they were coordinated and we were all talking to each other in our different silos. So we were initiated, as I mentioned, by some funding from the Alberta government and kicked off operations in 2023. The agreement between the 5 post-secondary institutions was so much fun to make, though that took us a little time. But once we got that going, money can flow between the institutions, which is awesome. Who are we? We're a number of researchers. U of A and U of C has the bulk, but we also have Red Deer Polytechnic, Lethbridge, and NAIT, as well as AHS, and we've started to grow the number of investigators part of this program. We had some founding partners as well in terms of industry. So we had a lot of the local industry here in Alberta making medical devices, as well as not-for-profits like BioHub, BioHubX, Health Cities, public organizations, and Canada-wide. We've put together a oversight committee to help us and guide us in our ways. So we have Utah from the provincial government, as well as an academic representative, Karen Chung from UBC, an SME expert, Peter Calvary, and then M&E expert, Jennifer Cox from Medtronic, as well as Mark, who is also up on the panel here from AHS. And so they're really giving us some amazing guidance on this program. We've also got some feedback from external folks about the science and the research itself. And so we've got some industry representatives, I won't go through all of them, industry, community, and scientific representatives to make sure that we're bridging the gap between all of those different areas. And so the next slide after this one is a big one, and I'm going to go through slowly. And oh, and I think it's got animation. Hang on a sec. It's coming. And I'm going to put them all up here before I talk. I forgot to check this part as I went through, of course. Click and one more. Okay, so Part of the money we've got is funding research. The very center there, there's different themes and research projects, and I'll talk a little bit about that in a second. We've got 3 what we call activation programs. So these are really things that are going to cut across all of the research programs and start to build up this ecosystem. So we envision these activation programs are what's going to live beyond the life of the AMedico funding that we have right now. So activation program 1 is around training. We're looking at skilling and upskilling. So mapping out what training programs exist throughout Alberta, finding where the gaps are, and making programs at one place accessible to people at other places across Alberta. So we're not duplicating efforts. The second activation program is around commercialization and partnerships. So here we want to make sure that we are streamlining the process of spinning out technologies from post-secondaries. We want to make sure we're supporting the local companies that are here, the small and medium enterprises, and we want to try to get some of the bigger companies to look at Alberta. And I think we can only do this by doing it all together. So we're trying to get some anchor tenants for them all. And then activation program 3 is around community and EDI. So here we really want to be solving the right problems, as I mentioned on the panel. So we want to build a framework for researchers to work with rural remote communities, Indigenous communities, older adults, children, to be able to listen, hear what the problems are, and be able to put together teams of researchers across the province, companies if we have them here, and start to co-develop solutions with those individuals. So we have something that is really needed and will be taken up by the community. And we've got a number of partners in those various places around that infrastructure. So you can imagine it takes a while to get all of this kind of coordinated and going, and I think we got a critical mass of activity now. So I'm going to talk a little bit about our R&D and the projects that we have. So we had 4 themes when we applied for the grant, and this is kind of where the strengths are in Alberta at the different post-secondaries. So diagnostics, monitoring, improved function and mobility, and then healthcare delivery and interventions. And I'll talk more about some of the projects that'll give you a better idea of what we were doing. So when we started the grant, we funded a number of researchers to kind of get things going and kick off activities. And so this is a super busy slide, but you can see that we funded a number of projects within the themes, but some that are cutting across the themes. So there's lots of things that are happening at the interfaces there. You might recognize some faces from U of A, from U of C, from Red Deer, Lethbridge, and other places. A number of different projects from wearables and materials to looking at stroke and rehab. And what we found, though, is that this funding model wasn't getting our researchers working with each other across the province. We want to be one province. So when we looked at all the researchers, and each little dot around there is a person on the grant, and who they were working with on these projects, it's not a lot. Remember this diagram because we changed things up for the second round of funding. So this shows there are a lot of people working across the province, but not together. So what we did in the second round is we didn't fund everyone in the first round. We really wanted to make sure everyone was participating, and we needed a new model. So we got a ticket system. Each researcher got a little ticket for money for research, but you had to work with someone at a different institution to cash that ticket in. So we developed some activities to get people to talk to each other and know what they're doing. Again, this is building up the collaboration. So we went from 17 of our PIs to 26 funded. We actually added 10 PIs that were not originally on the grant. So we're broadening the scope and really have a ton of cross-campus collaborations. So the round 2 projects, and again, there's on here with the lead, a lot of different types of ideas. This is not my favorite slide. The next one, where we show all the people now working together, and you can see all the different logos underneath, that we've got people working across the province now, so that we're having a united effort in developing these technologies. So remember that first diagram with all the circles around it and a couple little lines on it? Well, this is what it looks like now. So we've really started to build those collaborations. And when biomedical engineering and health technologies were set up at U of A and U of C in the late 90s, there were super complementary areas of strength that they decided to invest in and grow. And we're really now bringing those together and going across the province with Red Deer, Lethbridge, NAIT, and trying to build other programs as well. And you can see the new people that we brought on too. Our activation programs, I mentioned these are kind of cross-cutting elements. So these are like accelerators, except we didn't want to use the term accelerators because that's associated with a very specific kind of business type thing. So the activation programs, one is around training. So here we're working on developing or figuring out what the programs are at the different institutions and what's available, making sure that that's known across the province, and then identifying gaps, and then trying to figure out how can we fill those gaps and how can we have training more integrated with industry. We really know that students want more opportunities to integrate with industry before they graduate. How can we figure out how to do that so that industry is benefiting with new trainees and new talent, and our trainees are benefiting from that industry experience? The second one around commercialization, translation, and partnerships. Again, how do we streamline and make available all the resources across the province to any of those innovators that are looking to build new technologies and build new companies? So there are programs at various institutions, but they weren't talking to each other. They weren't working with each other. So we're working on a model of some hubs across the province so that there's focal points for people to go to when they're thinking about, okay, I have an innovation, I want to commercialize it, I want to build it, I want to prototype it, any of those things. There's places for them to go. And then I mentioned the last one, the community engagement, equity, diversity, inclusion, accessibility. Here, we're trying to really educate researchers about the need to engage end users and giving them a framework to reach out to those communities and listen, and then co-develop the solutions with them. So our activation programs have some amazing leads and coordinators, including John from NAIT here, who organized this whole day. So he does this as well. I don't know if he has like a third or fourth job maybe. And then we've got various leads and coordinators from across the province. Many of these folks are here today, and you can go visit our booth. I'm going to skip the next slide because I put really small font on there, and I'm not going to do that. And what we're thinking now is how can we go beyond a Medico? How can we build this so it has life after the life of the funding? So we've got that circle of researchers in the middle of the diagram there. There are many more researchers across all sorts of different faculties at these post-secondaries. How can we get them engaged and harness all of that brain power and all the trainees there as well? And then how can we bring in more industry and work on meaningful partnerships with that industry so that we can, again, co-develop solutions, support those companies, and grow everything up here. So final remarks, definitely go see Oyinda at the booth. She's our new coordinator, doing an amazing job. The email, amedico@ucalgary.ca, will get right to her. If you want to scan one of the QR codes there, you can follow us on LinkedIn. You can go to the website and read about all the researchers, all the different projects. There's a ton of information on there as well. And if you have any ideas about what else might be needed or what you could contribute, definitely come talk to us. Definitely reach out. This is for the province, by the province. So let's do this all together. And with that, I think I'm done. Any questions? I think there's a microphone. Or I can ask myself some questions. Hi, Vivian. Or if you're too shy, you can come up to the booth and talk to us as well. We'll be here for a little bit. Okay, if you're industry and you're here, we also have an Alberta Biomedical Engineering Conference every year in Banff. It'll be in Canmore this year, but close enough. So if you want to come and meet bright trainees, faculty members, reach out about that. A-Medical will also be at Inventures in a couple weeks. So if you're down in Calgary, come visit us there as well. We'll have some of the students and some of the faculty working on these projects there for you to meet as well. I asked and answered a question. All right, I don't think there's a moderator, so the time is kicking down. So if I'll hang out around to the front here, but thank you very much. And see.
Job.
Yeah, I don't think I'm better.
pack as much as we can. We've got to prepare for tomorrow. I can rest up and come relax. Okay, wow. So Friday we have an all day session at Air, like research. Get back to Calgary. Drive back at 8 a.m. Busy week. I think that's close to March. Yeah, pretty much. Much quieter. 1 month into the job, not 2 weeks. Still have 10 minutes. I worked at a children's hospital in neuropsychology. Yeah, before that I was time training. Yeah, SCP is like, yeah, Burnaby City right next door. First I'm still learning Alberta. Like that, driving up here, I'm like, oh yeah, this is where this is. I know, like, I don't know anything about it. I know the names, but like I've never gone past it. So. kind of have talked for quite a bit. I'm serious, dude. I think we should let that thing cool off for a minute.
I was looking at the A7 threes,
Oh yeah.
and then
We have a small but mighty crowd left over. Yeah, woo! Did you have a wonderful day? Was this not just so jam-packed? I know. What a fabulous day. And it is so appropriate to welcome the dean to the stage to say a few final remarks. What a beautiful day. So much hard work has gone into this day. Let's please give a warm and huge, oh, thank you. Hello up there. I see the students up there from their presentation this morning. Dean Terry Schlitter, who is Dean of the School of Health and Life Sciences, is going to take the stage now to close this beautiful, powerful, impactful day. Round of applause.
Thank you. What a wonderful day. As today's action-packed agenda comes to a close, I want to say thank you to each of you for your engagement and active participation in the summit. Your presence has made this event such a success. We've had insightful keynote addresses and dynamic panel discussions. We saw exciting, innovative projects at the Discovery Lab pitch competition and impressive student showcases. We also had the opportunity to hear encouraging remarks from the Minister of Technology and Innovation. All of today's sessions have underscored the pivotal role simulation will play in shaping Alberta's healthcare future. Through NAIT's spirit of creativity, collaboration, and innovation, we are witnessing the transformation of healthcare and technology in real time. I want to extend a special thank you out to the CAMS team for their outstanding efforts in leading and coordinating this event. Your dedication, Your dedication and hard work has been instrumental in making today a success. Let's carry this momentum forward, knowing that what we have built today will create a lasting impact for years to come. Thank you and have a wonderful evening.
A few last notes. I'm not sure if you know this, but there is a podcast that you can tune into. Has anybody listened to that just yet? Oh, yeah, wonderful. We've got a big fan up there. It's called Advancing Healthcare in Simulation Podcast, and you can find it on YouTube, and you can also find it wherever you get your podcasts. So we're going to keep this conversation going. I know that there are more episodes in the works, and a few of them are going to be released soon. So if you're already a fan, more content is coming. If you hadn't had a chance yet to listen, do so. There are some wonderful interviews. And again, it just keeps this conversation going. There are also a number of really fantastic events coming up, events that all of you will probably be at. So you'll be able to network more and talk about more collaborations. Inventures is coming up, Upper Bound, and also Life Sciences Week. So make sure to mark the calendar for those upcoming events where you can see a number of the people who were here all day today. Also, there is going to be a QR. There it is. If you wouldn't mind taking a picture and scanning this QR code, it is for your feedback. It also is going to be coming in the form of an email in a couple of days. But for those who put together this event, your feedback is really, really important so that we know what was great and what we can do better for next time, because there will be more events like this. So powerful, so impactful, bringing all of these minds together on this stage. What a day. So thank you, everybody, for being a part of this summit. It was wonderful to see all of you here today. A huge congratulations to those who put this together. Safe travels home. Thank you for being here and have a great night. Bye-bye.